Welcome back to a new day. For men, there's the little blue pill. Now, for women, there's the little pink pill. The FDA has approved the first ever drug to treat sexual dysfunction in women. It is known as the female Viagra. It is not without its share of controversy, including a list of potentially dangerous side effects. So we're going to talk to Dr. Jennifer Caudle. She's a family physician at Rowan University. The good doctor joins us now. Good morning, Dr. C.
Good morning, Michaela. How are you?
I'm good. I mean, Chris has been teasing Allison and I about this female Viagra. Why are we talking so much about it? But it has the attention, at least of the female population. So help us understand how we are all quite familiar with Viagra and its effects. How is this pill different and what does it do?
Okay, well, first of all, let me start off by saying that this is actually not the female version of Viagra. Viagra is actually a very different pill that we use for men. This is a medication for women that helps improve sexual desire in women. And it's different in that this particular pill works in the brain. So it works on all these neurotransmitters and chemicals in the brain. And even though we don't exactly know the exact mechanism, that's how it improves sexual desire in women and the stress that sometimes can come along with that.
So we know that sexual desire in women can decline after menopause as we get older, et cetera, et cetera. What kind of population are we talking about? What are the numbers? How many people are suffering from this kind of problem?
Okay. Well, there are many, many women that are suffering from sexual dysfunction of many different types. Remember, there's a whole range of different types of sexual disorders and dysfunction. And when we talk about hypoactive sexual desire, this is something that's very common as well. You know, I think one of the most important things about this conversation that we're having about this little pink pill that we keep calling it is that it really is hopefully going to allow women to talk with their doctors more about how they're feeling and what's going on in their lives, something that I don't think always happens.
All right, so the big thing is there's been debate, there's been controversy. The FDA failed to pass this, legalize or approve the drug twice before. In fact, just in June, it was turned down because of risk factors. And this is what is sort of some of the controversy around it. What are the risk factors and how serious are they, Dr. Caudle?
Right. Well, that's a really good point because you're right. This drug was actually denied twice in the past by the FDA. The FDA at those different times said there were problems with how effective the drug actually was. There were questions about that and also the side effects. The drug has now been approved. What's different, you might ask, is, well, there have been more studies and there have been two major caveats placed on this medication, okay? First is a black box warning about the side effects. So the side effects, you ask, what are they? Well, first of all, one of the major side effects is potentially low blood pressure, okay, hypotension. But the second main side effect that we can experience is passing out, or what we call syncope. And these can be particularly dangerous and even worse if a woman were to drink alcohol while taking the medication or if she were on other medications while taking this particular pill. So those are really important things to keep in mind. And honestly, they are so potentially serious, and the FDA is so worried about them. Not only do they have the black box warning, but physicians who want to prescribe this medication actually have to undergo a training course and become certified in order to prescribe it for these very reasons. So these are important sort of pros and cons that we really need to be thinking about when we look at this medication.
An important point to point out that you don't just take it when you want to sort of get in the mood as Viagra is used. You have to take it every night. Thus the concern about drinking alcohol, et cetera, because it would mean not drinking alcohol in the course of the time you're taking it. So where do you stand on it? Do you think that this is going to, as some supporters say, the end of gender bias in treating sexual dysfunction?
Well, you know, look, I hope that we're seeing the end of gender bias, whether we have this pill or not. I'm hoping that's the direction that we are going in general. You know, as a family physician, something I've been thinking about is when I get into the office today, I know I'm going to have a lot of questions about this medication. I think that there's going to be a lot of good things happening, right? People are going to be talking about, women in particular, about sexual function, sexual desire, and sexuality. That's very important to talk about openly. But I think on the other side, we do have to look at the risks and the potential risks of this medication. You know, there has been a lot of controversy about it. And you mix all these components in a pot and you're really going to come up with lots of pros and lots of cons. So this is where I always say that conversation with your doctor is important.
We love it. And you're our doctor. We appreciate it, Dr. Caudle. Good to have you with us today.
It's good to see you.